By Monday morning, more than 400 children had received life-changing corrective surgeries for birth defects, all thanks to a 2-week pediatric surgical camp at Lira Regional Referral Hospital. The camp began just last Monday and is set to wrap up this Friday. In that short time, over 2,000 children have been screened and hundreds have already undergone successful surgeries. Dr. Andrew Odo, the hospital's acting director, says the camp is tackling a long-standing challenge that many children born with treatable conditions but left to live with pain and a poor quality of life.
We are excited to inform the general public that we have been able to attract very many babies ranging from birth up to 19 years. So those are the categories that we are considering. However, within the 1 week, we have been able to work on about 400 babies already. And this is a big number that in the beginning when we were planning, we thought we would not reach that number. But in just 1 week, we are at 400. Now, within this one additional week, we think that we are going to surpass our target. We had thought after 2 weeks, we should be able to work on 600 babies. But the way it looks at the moment, I think we are going to go past the 600 mark, maybe to 800 going to 900 children being worked on. And this resonates with our earlier problem that we discussed, that the number of babies born with abnormalities is quite high in this region. We talked about abnormalities like hernias, we talked about undescended testes, we talked about defects around the genital tract, both male and female, challenges around the anal orifice. All these are conditions that we are able to see during this camp. And having this camp done in Lango sub-region is a blessing because it's one of the answers that we are going to have to work on these babies who are born with the congenital defects. We anticipate that in the future we should be having more frequent camps to clear the backlog that is existing in the community. And indeed, if you see the number of people that have been screened, more than 2,000 in these 2 weeks. So which means if we work on only 800 to 900, we still have a big number of people who will have not received the service. Our technical team have taken account of all these people and their medical conditions and surgical conditions. So they will be planning, scheduling them for routine repair within the hospital because we have a resident pediatric surgical team.
The lead pediatric surgeon, Dr. Charles Newton Odong, explained that while the camp primarily targets hernia cases, children with other conditions such as undescended testicles and imperforate anus are also receiving care. Hernias are a common birth defect occurring when a weak spot in a child's abdominal muscles allows internal tissues to bulge out, usually around the belly button or groin. Hernia are a common birth defect occurring when a weak spot in a child's abdominal muscles allows internal tissues to bulge out, usually around the belly button or groin. This camp was made possible through a partnership with Love Without Boundaries Uganda, an international charity organization. Its director, Ronald Sejuko, said Lango sub-region was chosen because of the urgent need. However, with the camp ending this Friday, authorities worry that many children may miss out not only because lack of will, but simply due to time running out.
These birth defects, they come in several, I would say, severity or intensity. If a child has a huge hernia on the groin or extending to the scrotum, they're going to be having pain most of the time. They try to run a little bit, the thing swells and they get a lot of pain. So such a child is not going to be able to experience life like other children, playing about, learning as much as possible. It may even affect their ability to be retained in school because of this falling sick all the time. We have children with undescended testes. If not attended to within 1 year and a half, the testes may not work in the future. So this in the end affects the reproductive ability of such a child if not attended to early. And of course, many other defects, those that are involving the anal area, may be experiencing pain, difficulty in passing stool, so the quality of life is affected.
Still, for hundreds of families, this camp has brought a new hope and a better future for their children. Story compiled by Amony, Immaculate for Uganda Radio Network.